Good evening, everyone. I'm Anu, your coordinator for today's discussion. Today's discussion is based on reading part C, day 3, difficult to treat depression. First of all, I'm thanking Father Salim Joseph and our admin panels for giving this wonderful platform and this discussion session. So now I would like to call each participant for their questions.
Hello everyone, good evening. I'm Reshma Sayyed. First of all, I would like to thank all the admin panel for arranging the slides and thank you everyone. We'll begin today's discussion regarding this paragraph. Okay, so before going to question, I would like to tell you that according to the father, the first paragraph is always a gist base. Gist base means you have to know the detailed information, the key information. What is the para or author or information is there in the paragraph, irrespective of your options or your question. Okay. So, if you know the first para in detail, the key concept, if you know, then you will be able to tackle or handle all questions in a para. Okay. So, this is what father says. Okay. So, we know that this the main heading of this paragraph is difficult to treat depression. So, as a healthcare professional, like to know why it is difficult to treat depression. Okay, like other any physical conditions like diabetes, hypertension. Why compared to that? Why this is most difficult?
Because that person never express their feelings
It's
or any
non-curative.
condition.
Yes,
Because
correct.
these patients, we cannot rely on their words and they cannot express real symptoms.
Yes, yes. So there will be somewhere a communication gap is there, correct? So either from the patient side, either from the family or anywhere, there will be a communication gap. So this with this knowledge, we'll proceed to our paragraph. Okay. So first, I will read the question because we have to follow the QTA strategy. In the first paragraph, the what point does the writer makes about the treatment of depression? Okay, so here the stem of the question, the key word of the question is what point? What are the reason? Okay, what are the reason to make the treatment about the depression? Okay, so author is telling to find the reason why it is difficult. Why it is difficult to treat the patient with the depression. Okay, so I'll read the paragraph. Depression remains leading cause of distress and disability worldwide. Distress means what? Stressing. It causes stress and disability. Disability means not move from one place to another. Okay, worldwide. In one country survey, the health and well-being in 2007, 7.2% of people surveyed had experienced a disorder, mood affective disorder in the previous 12 months. Those affected reported a mean of 11.7 disability. According to the father, whenever you see numbers, okay, you have to highlight at that time only. Okay, it will help us to fetch the correct answer. Okay, 11.7 disability days when they were completely unable to carry out or had to cut down on their usual activities owing to their health in the previous 4 weeks. There was also evidence of substantial undertreatment. Amazingly, only 35% of people with mental health problem had a mental health consultation during the previous 12 months. Three quarter, you should highlight this while doing. Quarter of this seeking help saw a general practitioner in 2015 and 16 follow-up survey. Not much had changed. Again, there was evidence of substantial unmet need, and again GP were the health professionals most likely to providing care. Okay, Okay, so we after reading this, we have highlighted the important one, or important keywords. So option says in option A, 75% of depression sufferers visit their GP for the treatment. Okay, so with this option, we have to see whether 75 people who are depressed visit their GP to treatment or not. Okay, GP struggle to meet the needs of people with the depression. So we have to see whether GP is struggling. GP is who? General practitioner. Okay, is struggle to meet the needs of a patient. Okay, C will be the treatment for depression takes an average of 11.7 days a moment, and option D will be the most people with the with depression symptoms never receive help. Okay, so here by this, can I say most is a absolute here? Most and never is a absolute here?
Absolute.
Yes.
Most is not absolute.
Yes.
No,
Most.
never also not
It's a
absolute.
scale expression.
Yes. Yes. So it's a scale expression. Most is showing the quantity. Okay. Most is showing the quantity. So it's a scale. Yeah, high, low, like that. Okay. And never is if instead of most, if in the option all is mentioned, that time it would be a absolute expression. Okay, so according to the strategy, when there is option is not an absolute, that might be the answer, that according to the for the strategy. Okay, so we have to who are very competent, they can take this answer. Okay, but why other options are not correct? Okay, so here we will discuss. So option A, 75% of depression sufferers visit to their GP for the treatment. Okay, so 75% means there we should here you can see only 35% of people with mental health problem have mental health consultation. Okay, so if there is a survey of 100 people, so only 35% people who are actually depressed are going to the mental health psychiatric doctor instead of GP. Okay, so according to the para, what is the what main point here? Difficulty to treat. If all 100 people go to the mental health, there will be any difficulty, there will be any difficult expressions in the para? No. So only 35 people are visiting the doctor, visiting the mental health doctor, doing the mental health consultation, and rest how many? 65% people are visiting the general practitioner. That's why it is a difficult to treat the depression. Okay, this is bit challenging option. Kindly refer to the father's video. Okay, so now we'll go to the option C. GP struggles to meet the needs of patient with the depression. So in the para, it is not mentioned that in anywhere ki general practitioner is having any difficulty. It is not mentioned. It is not mentioned in the paragraph. Okay, and that's why we should cancel the option B also. Okay, now option C. In the option C, the treatment for the depression takes average of 11.7 days a month. But in the para, what is mentioned? Uh, it is mentioned 11.7 days of disability, where where the patient is unable to perform any activities. He will cut off from the everyone. Okay, he will not do any daily rituals, daily activity. So it is not mentioned in the paragraph. That's why option A, B, C is deleted from the answer list. Hence, D is the correct answer. So now we'll go to question number 8. Sorry. Okay. In the second paragraph, the writer suggests that GPs. Okay. So here, whenever there is a words like suggest, advise, recommended, this type of words come, you should always think of modal verb. Modal verb. Okay, you should always look for the modal verbs. And what are modal verbs now? Okay, modal verbs are nothing but special helping verbs used to express the necessity, possibility, or permission or ability. Okay, so we'll see in the option whether these types of words are there. So I would like to, it is already mentioned in the videos. I would like to give some examples of modal verb, like words like can, could, may, might, should, might, will, and would. These are the common examples of modal verb. If these words are there in your options, that could be a correct option, correct answer. Okay. So once again, I will read the question. In the second paragraph, the writer suggests that G. Okay. So writer is saying GP do something, should do something. Okay, have to perform something, should recommend something, like that. If any options is matching, we'll see whether it is an answer or not. Okay, so here option A is saying uh, are are in a good position to conduct long term studies on their patients. Okay, so here in the paragraph, it is option A suggests are in a good position to conduct a long-term studies on their patients. So we have to see whether in this para any matter is related to any study. But I could see here. Okay, while GPs have many skills in the assessment and treatment of the depression, they are often faced with the people with depression who simply do not get better despite the use of proven psychological and pharmacological therapies. GPs are well placed in one regard as they have a longitudinal knowledge of the patient. So here they are not saying about any studies. They are saying it. They have a longitudinal, long-term knowledge is there. They are not saying about the data. Okay, so that's why this option A should be cancelled. Okay, then option A should be cancelled. Understand his or her circumstances, stresses, supports, and can marshal this knowledge into coherent and comprehensive management plan. Of course, GP should not shoulder on alone if they feel the patient is not getting better. Okay, so here it shows that modal verb you can see. Okay, so option C should be a correct answer. Okay, here option B doesn't have any similarity with the paragraph. It is not mentioned whether uh, is there any lack of treatment or lack of training or is there in the paragraph. For example, on top in the first line, it is showing GPs have many skills and assessment in the assessment. So option B is saying completely opposite. Okay, so option B should not be the answer. Okay, now what about D? Okay, D sometimes struggles to create a coherent management plans. Just see, can marshal this knowledge into a coherent and comprehensive plan. So option D is the completely opposite of that. Here in the paragraph, it is mentioned they can marshal. Marshal means good. They can. They have the ability. They can marshal it. Okay, they can be a good position to do. But option D is saying completely opposite. Sometimes struggle to create a coherent and management plans. Okay. So that's why D should not be the answer. Okay, people who are very competent, very much good in their competency can directly fetch for the modal verbs. Okay, which is straight away we can see in the option C. Should is there. Should seek the help when treatment plans are ineffective. Okay, this suggests the our paragraph last line. So that's why C is the correct answer. This was a bit challenging for please see the father's video once. Thank you.
Okay, good evening to all. Thank you so much. First, I would like to say thank you so much, Father Dr. Sareem, and all admin panel members to giving me this opportunity to explain reading part C. And now I'm going to explain reading part C, question number 9. See here, what the question is saying. What do the result of the study describe in the third paragraph? The option is GP prefers the term treatment resistant depression to difficult to treat depression. Option B, patients with difficult to treat depression sometimes get stuck in treatment. Option C is saying the term difficult to treat depression lack a precise definition. Uh, Option D, there is an identifiable subgroup of patients with difficult to treat depression. Now I'm going to read paragraph. In trying to understand what happens when GP feels stuck while treating someone with depression, a qualitative study was undertaken. The aim to gauge the response of GPs to the term difficult to treat depression. It was found that while there was confusion around the exact meaning of the term, GPs could relate to it as broadly treatment resistant depression as generally reserved for a subgroup of people with difficult to treat depression that has failed to respond to treatment with particular management implication. So, as for before Reshma ma'am already explained about that, we need to know about synonyms and everything. So it will be easy to find answer. So C option C is there. The term difficult to treat depression lack a precise definition. So what do you think about lack? Could you please tell me someone? So I will explain about lags. They are saying lags. Lags it means there was a confusion. Lags means there was a confusion, and the precise definition means exact meaning of the term. So as per Father Stacey, we should know the synonyms and about everything. So it will be easy for to find the answer. So the answer is our answer is here option C. What they are saying, it was found that while there was confusion around the exact meaning of the term, so this is showing option C. So our answer will be correct option C. And why all another option is wrong, we will see in this. The option A is saying GPs. See here, first one is saying GP prefers the term treatment resistant depression to difficult to treat depression. In that option is saying GP prefers, but in the text they are saying, see here, treatment resistant depression. Treatment resistant depression. What do you think about that? It is treatment resistant depression. It means subgroup, and the difficult to treat depression. It is a generally. So, so what's the mean of treatment resistant depression? Is it a subgroup? And the difficult to treat depression is means generally. Like first one is saying particular. The second was saying generally. So in the text, you see first one, GP prefers the term treatment resistant depression to difficult to treat depression. So they are saying more specific in the text, more specific terms such as a treatment resistant depression are generally reserved for a subgroup of people with difficult to treat depression. So they are saying it's different. Because of that, we will eliminate option A. The option B is saying patient with difficult to treat depression sometimes get stuck in treatment. So option they are saying in trying to understand what happens when GPs feel stuck. So in that option they are saying about patient, but in text they are saying about GPs. So because of that, this is entirely different. So we will eliminate option B. And D option D is there. There is a identifiable subgroup of patients with a difficult to treat depression. They are saying about what we see here. They mention different to treat depression is the main group, but they are changing subgroup into main group. So because of that, we will eliminate option D. Now I'm going to explain question number 10. So the question is paragraph 4 suggests that the option is saying prescribing analgesics is unadvisable when treating patients with depression. Option B is saying the co-occurrence of depression with chronic condition makes it harder to treat. Option C is saying patients with depression may have undiagnosed chronic physical ailments. Option D is saying doctors should be more careful when accepting pain complaints as legitimate. And I'm going to read that text. One scenario is which depression can be difficult to treat is in the context of physical illness. Depression is often expressed via physical symptoms. However, it is also true is that people with chronic physical ailments are at high risk of depression. Functional pain syndrome, where the origin and cause of pain are unclear. The particularly tricky complaints of pain requires the clinical to accept them as legitimate. Even if there is no obvious physical cause, the use of analgesics can create its own problem, including dependence, patient with comorbid chronic pain and depression require careful and sensitive management and long-term commitment from the GP to ensure consistency of care and support. A is saying prescribing analgesics is un, unadvisable when treating patient with depression. So, see in the last para, I highlighted in the yellow color. So, the text is saying the use of analgesics can create its own problem, including dependence. So they did not mention anything about here unadvisable. So because of that, we will eliminate option A. And option C is saying patient with depression may have undiagnosed chronic physical element. So see in that text, the second one line, it is also true the it is also true is that people with chronic physical ailments are at high risk of depression. They are saying it is a true. True is means must. So you see here in the option there mentions model verb also. So may means it's not very sure. So and but in the text they are saying it is true. So and also they are saying at a high risk of depression. So they did not. It's entirely different according to the text and option. So because of that, we will eliminate option C. Okay, the last one B is there. Doctors should be more careful when accepting pain complaints as a legitimate. In the text, you see here, complaints of pain require the clinical to accept them as a legitimate even if there is no obvious physical causes. In the text, as the father strategy, we know there is a model verb. This is should is a model verb. But in the text, they did not mention anything about should. So we will eliminate, sorry, option D. Okay, they are saying requires. Requires means it is must. Because of that, they did not tell about anything should. So we will eliminate option D. Then option B is the correct one. The co-occurrence of depression with chronic condition make it harder to treat. See here, first line. One scenario is in which depression can be difficult to treat is in the context of physical illness. So, co-occurrence means what do we think about co-occurrence? Co-occurrence means physical other chronic illness like physical illness. Okay, so in that text they are saying physical illness, and so there is a synonymous language. So co-occurrence means physical illness or other chronic condition. So our answer will be option B. Okay, I hope I cleared this question. Thank you so much. Good evening, I'm Bharati, one of the OET aspirant from EduSkills family. First of all, I would like to thank you, our father and our admin panel members. Today I will discuss about reading part C. According to paragraph 5, people with PPD, A, depression occurring as a result of the disorder. B, it is noticeable mood changes which are central to their disorder. C option says a tendency to have accidents and injure themselves. D option says problems tackling the topic of their depression. Here we can take our logic word like people with BPD have depression. People with borderline personality disorder have mood changes. Or third option says people with PPD have accidents. Then our key option fourth is people with PPD have problems tackling. So our test is saying it is often difficult to tackle the topic of depression co-occurring with borderline personality disorder. People with borderline personality disorder have a part of the core disorder, a perturbation of affect associated with marked variability of mood. This can be very difficult for the patient to deal with and can feed self-injuries and other harmful behavior. Use of mentalization-based technique is gaining support, and psychological treatments such as dialectical behavioral therapy form a cornerstone of care. Use of medications tends to be secondary, and prescription needs to be judicious and carefully targeted a particular symptoms. GPs can play a very important role in helping people with BPD, but should not do it alone, instead ensuring sufficient support for themselves as well as the patient. People with PPD have the first option is saying depression. Depression occurs as a result of the disorder. Here, that is this not mentioned in the paragraph. I will explain to again also. Then option B is saying noticeable mood changes which are central to their disorder. Their first second line is saying people with PPD have, then we can ignore our subject complement. We can read like people with PPD have a perturbation of affect associated with marked variability of mood. Variability of mood means mood changes. So we can go with the B option. Then C option is saying a tendency to have accidents and injury themselves. Here it is mentioned this can be very difficult for the patient to deal with and can feed self-injuries and other harmful behavior. Here they are not mentioned about accidents, and it is self-injuries means it like if you are sleeping more, it is harm to our health. That is called self-injuries. Here it is option D is not D is it is saying general statement problem tackling the topic of their depression. Here its first line is saying it is a often it's a scale often difficult to tackle the topic depression of co-occurring with the borderline personality disorder. So it is not it is done it is not the same. So we can eliminate D option. A option is not mentioned, so we can eliminate depression occurring as a result of the disorder. It is not anywhere mentioned. That is also we are getting answer from people with PPD have perturbation of the affected associated with marked variability of mood. It means the paraphrasing of noticeable mood changes which are central to their disorder. Okay. Now we'll go to number question 12, please. Okay, this is from the same paragraph only. This lexical phase question. So we can go directly the highlighter words. The paragraph fifth says, what does the phrase form the cornerstone mean regarding PPD treatment? We need to get the meaning of form the cornerstone. First option is saying psychological therapies are generally the basis of treatment. Second one is saying there is more evidence of using mentalization than dialectical behavior therapy. Dialectical behavioral therapy is the optimum treatment for depression. Fourth one is saying in some unusual cases of prescribing medication is the preferred therapy. We can go direct over this highlighted word. Here it mentioned use of mentalization based technique. Before the highlighted word, we can read it. Use of mentalization based techniques gain support and psychological treatment such as dialectical behavior therapy form of cornerstone. This is psychological treatment. Here it is mentioned psychological treatment. We can remove the word like ignore the word like such as or include like that. We can remove the word, ignore the sentence and we can read it is short like psychological treatments form the cornerstone. So our first option is saying psychological therapies are generally the basis of treatment. Psychological therapies means here treatment, psychological treatment is mentioned. Then the basis of treatment means form of the cornerstone. So we got already our answer. So we no need to go B and C and D also. Thank you for your patience. Thank you everyone.
Good evening, all. I am Denidu, one of the OET aspirant. First of all, I would like to thank Dr. Sarin Joseph and all admin panel to giving this opportunity for me. So today I am discuss about question number 13 and 14. So we can go for question number 13. In question is in paragraph 6. What does the writer suggest about research into bipolar depression management? So, answer options are there is enough data to establish the best way to manage bipolar depression. Answer B, research has not provided the evidence for an ideal management plan yet. Answer C is a lack of patience with the condition make it difficult to collect data on its management. Answer D, too few studies have investigated the most effective way to manage this condition. Yeah, in here you can see in the question is same, we can mark as heading words writers suggest and ask about and management. In question, answer A, heading words are enough data. In answer B, heading word is has not provide and management plan. In answer C, heading word is lack of patience and difficult to collect data on its management. In an answer D, heading word is too few studies and effective ways to manage. Then we can go to the paragraph. So we can read that. Another particularly problematic and well-known form of depression is that which occurs in the context of bipolar disorder. Prime data on how best to manage bipolar depression is surprisingly lacking. You can see some synonym and paraphrasing in one option. In this sentence, prime data on how best to manage bipolar depression is surprisingly lacking. In answer option A, it mentioned there is enough data to establish the best way to manage bipolar depression. You can see it's surprisingly lacking. It means this is not enough data. But in answer option A, say that is they have enough data. So that is opposite. So we can eliminate that answer option A. Then Then answer option C, a lack of, answer option B, research has not provided evidence for an ideal management plan yet. You can see some synonyms and words from that sentence and also the answer option. Can anyone tell the research? What is the synonym that indicate in this sentence? The prime data on how to best manage bipolar depression is surprisingly lacking. What is the synonym for research? Prime data, where we can the synonym for research, and has not provide. It is synonym for surprising. Sorry, lacking. So another thing is, sorry, ideal management. It is synonym for best to manage. So we can think this will be the answer option. Then we can go to answer option C. A lack of patience with the condition make it difficult to collect data on its management. In here, in the paragraph, I will read that another sentence. Okay, it is clear that treatment such as post antidepressant can make matters a lot worse, with the potential for indication of mania and mood cycle acceleration. However, creatine medication, notably some mood stabilizers and atypical antipsychotics, can alleviate much of the suffering associated with bipolar depression. Specialist psychiatric input is often required to achieve the best pharmacological approach. For people with bipolar disorder, psychological technique and long-term planning can help prevent relapse. Family education and support is also an important consideration. Actually, we no need to the read the whole paragraph because we already know they have synonym the paraphrase with the answer option B. And also the answer option C and D in here not mentioned. Then we can, as I explained here, here is the answer. We can select the answer option B. Research has not provided the evidence for an ideal management plan yet because it is in the first instance it indicates prime data on how to best manage bipolar depression is surprisingly lacking. Yeah, this is the synonym. So I think that question explanation is clear. Then yes, I am going to next explain question number 14. Question number 14 is in paragraph 6. What does the writer suggest about the use of medications when treating bipolar depression? In here, answer option A, there is evidence for a positive and negative result of different medications. Answer option B, medications typically make matter worse rather than better. Answer option C, medication can help prevent long-term replace when combined with family education. Answer option D, specialist psychiatrists should prescribe medication for bipolar disorder rather than GPs. In here, in the question is
Bipolar depression.
In the question is same, the hedging word is writers suggest and use of medication. Then the answer option A hedging word is there is evidence, positive and negative results. Also you can see and fanboy. So we can guess this will be the answer, but we can read other option also because they have a and fanboy. Okay. Answer option B, medication typically make matters worse rather than better. Hedging word is typically make matters. Answer option C, hedging word is medication can help prevent long-term replace. Then answer option D, hedging word is specialist psychiatrists and then GPs. Then in here we already read the first two sentences in this paragraph, so we can go to direct after that. Okay, it is clear that treatment such as unforced antidepressant can make matter a lot worse, with the potential for induction for mania and mood cycles acceleration. It means it explain about some negative things. Okay, after however, creatine medications then can alleviate much of the suffering associated with bipolar depression. It means after however they will explain some positive thing about this
Medication.
medications. Okay. Then also Answer option A, that they speak about both positive and negative results. Okay, then answer option B, it tell about only negative. Then answer option C, the option talking about only positive idea. Okay, then you can see in answer option D, especially psychiatric should, that is modal verb. Actually, this is question answer. It talk about prescribed medication, but in question it asks about use of medication. So there we can eliminate answer option D because it is indicate the prescribing medication, not about the use of medication. But previous three answers, they are talking about use of medication. Okay, then we can eliminate answer option D. In this A, B, C answer option, you can see there is a two particular answer and general one. Okay, so general, if according to father strategy, if we have two particular answer and one general, we can choose a general one as the answer. If we have a two general and one particular, we can use a one particular answer. So here answer option A is the this is the general one. So it is explained about there is evidence for positive and negative result of different medication. Then as I told earlier, you can see before, however, that in this paragraph it is explained about some negative expression. Then after, however, they are explaining about positive expression. So we can select the answer option A as a correct answer. And also they have one strategy and it is fanboy. So we can select answer A as correct answer. I think my explanation is clear for you. Thank you all.
Yes, thank you, Dinidu, for your explanation. And thank you, everyone, for your active participation and sincere effort today. Each one of you did very well and made the session meaningful. A special thanks to mentor, admins, and all participants. Happy learning and best wishes to all.